Hi, my name is Erin McFall, and today's date is October 5th, 2023. And today we will be discussing the endocrine system, specifically endocrine imbalances and conditions. And I have chosen one specific condition to go over today, and that condition is known as hypothyroidism. Hypothyroidism is a condition that affects the thyroid gland in the neck and is due to the lack of thyroid hormones being produced. The reason why I chose this condition is because I was diagnosed with hypothyroidism a couple years back, and I am currently unmedicated and untreated for this condition. So I wanted to look into it a little bit more and see the symptoms, causes, and treatment plan that could be right for me. So that is why I chose this, to look a little bit deeper into it. So the symptoms that I currently have for this condition would be weight gain, fatigue, and weakness. And I know that those three symptoms are pretty common for this condition, but some other common symptoms are swollen lymph nodes, which is known as a goiter, depression, dry hair and skin, and muscle aches. But if you look a little bit deeper into this condition, there is a wide range of signs and symptoms that a person might undergo. The cause of this condition is because the thyroid gland is not producing the thyroid hormone, so there is a series of tests that can test for that. So typically it is a blood test that is used to test for the thyroid stimulated hormone and how much of that is being produced. If that comes back high, a second blood test is run to look for the T4 hormone levels in the body. So these two tests can be the determining factor if the patient has hypothyroidism or not. TSH has to be high and T4 has to be low, I believe. So some of the causes for hypothyroidism is somebody could be born with it. It could be genetic. And whenever a person's born with it, it's called congenital hypothyroidism. It may come from Hashimoto's disease, which is another thyroid condition. But what makes Hashimoto's different from hypothyroidism is the immune system attacks the thyroid gland instead of just the lack of the thyroid hormone being produced. But it can lead to hypothyroidism if you have Hashimoto's. In a rare form, but in my case, it can be due to an iodine deficiency, and that's usually because somebody might not be getting enough iodine in their diet. And so your iodine levels can be checked whenever you are being tested for hypothyroidism, and that might be the cause. There is no current cure. There's no current cure for hypothyroidism, but it can be treated. You can go see an endocrinologist to test for the thyroid hormone imbalance, and then they can provide a treatment plan for you. Usually it's a oral pill that is taken daily, and the name of it is levothyroxine, and it is taken daily to balance the low thyroid levels in the body and the blood. So there are periodic blood tests done to show if this treatment plan is working for you or not, and the doctor can administer more or less of that drug if needed. If not properly treated, it can lead to heart problems or high levels of LDL, which is low density lipoprotein cholesterol, which is the bad cholesterol. So that is definitely not something we would want to mess around with. And infertility can also be a symptom that comes from untreated hypothyroidism, along with a couple other things. So that is all I have for today in the discussion of hypothyroidism. I'm really glad I chose this because I learned something new. So thank you so much.